Dane County is seeing its largest increase in COVID-19 cases since the beginning of the outbreak.
Here to discuss that and take your phone calls at 270-9933, 270-9933. Dr. Zorba Paster, thanks for being with us today. What do you make of this big increase in Dane County?
Well, the fact is the big increase is there because we're not social distancing. We're seeing our friends. I can see a difference even walking into the grocery store or walking into Home Depot where I may go, or walking into Walmart. People a week ago, 2 weeks ago were wearing masks. Now, half the time I see people not wearing masks. And if you don't wear masks, you've got COVID, you don't have symptoms, you're going to spread it. And I think that's really where the uptake is. The other thing is people are beginning to really socially get closer and closer indoors. And I think really the key here is not just to wear a mask, but if you're going to see your friends and relatives and open up your circle of friends, what you really want to do is you want to do it outside and you want to talk to them. And you sort of want to be 6 feet apart, just like we know, because we don't know who has COVID and who doesn't have COVID, but we know more and more people in Dane County are having COVID because the numbers are spiking.
Do you think that a lot of this also might be due to the fact that, people were getting, cabin fever in a sense, and then now once things were lifted and the weather got warmer, everybody's just rushed to get outside and they want that normal?
I think you hit it right on that. You never realize the importance of social interaction. There are a few things they didn't realize. Number one, the importance of social interaction when you're actually with other people. And the other thing I realized was something in the grocery store. When you go to the grocery store and you have to open up those plastic bags in the veggie section, I never realized that I would take my fingers and put them and put them in my mouth to actually get the bags open. And I don't think any of us realized we did that. What a way to spread germs. And it never even occurred to me. So there are lots of things that I think they're important. What's really important is we are not anywhere near where we're going to have an immunization. It certainly is not going to come this fall. We're not going to see a drop in COVID this fall. It is not a seasonal virus. We're probably going to see an immunization sometime next year, but by the time you get it out to enough people, it's going to be quite some time. And so you've got to practice good social distancing. If you're going to see people, you want to do it outside. And don't go to bars. Don't go to places where you're going to be close to people. And if you're going to go and be close to them, try to be far away and wear a mask. Be a good citizen. That's going to keep it from spreading because, frankly, it's kind of frightening that it's going up again. And when it goes up, that means more and more people are going to get sick, which means more and more people in Wisconsin are going to die.
And it is skyrocketing in places like California and Texas and Florida.
If you look at the Sun Belt, if you look at the areas out west, California, Arizona, New Mexico, Utah, other places, Texas, even Texas, other places where it wasn't nearly as much. It's now skyrocketing. Why? Because among other things, people are going there from other places in the country and they're not social distancing because they thought it can't happen here.
Right. No,
the answer is it can happen here, and your goal is not to have it happen in your household. And when you protect yourself, you protect me.
270-9933 is the number to call to talk to Zorba. We'll go to the phones and we'll start with Mary in Madison. Hi, Mary. What's your question?
Well, I just wanted to comment that there's no excuse for cabin fever. I've been in the house for about 3 months. I watch TV, read, and look out the window. And that's what I think more people should do. And I wish there was a way to make them follow the rules. You see people outside, a big crowd, and there's a lot of them, no masks. That's all I wanted to say, and thank you.
All right, well, Mary, good point.
You hit it on the head. Many of us we do get cabin fever, so we want to see others. But the fact is, if you're going to see others, do it the right way. The issue is just like washing your hands after you're in the bathroom. It's good, it's polite, it's appropriate to wash your hands. It's the same with wearing a mask and staying 6 feet apart. And for those of us who want to get outside, you got to do it that way, or don't go outside. Read a book, watch TV, and go to sleep.
It's tough with kids, though.
It is tough for
tough with kids. It's always tough with kids. If you look at 20-year-olds and 30-year-olds, if you look at teenagers, they want to be close to one another. They do not, on the whole, get as sick, but they certainly spread it quite a bit. And the fact is, you've got to just educate your children and young adults to do it. Once again, it's good parenting and it's good citizenship for our youth.
All right, let's go to our next caller, Charles from Janesville. Hi, Charles. What is your question?
My question is, a a person with O positive, are they acceptable also to B positive? And are B positive patrons also able to take O positive?
Well, first of all, if you get blood in this day and age, you get the exact same blood type that you have. So if you're O positive, that's what you get. If you're B positive, that's what you get also. That's the way to do it. On the battlefield, O positive is the universal donor. So if you've got somebody who's O positive and you don't know what the other person is, you give it to them exactly. But when you go into a hospital, if you get blood, it's type and cross. In other words, they take the blood you're going to get, they type it with your blood that you have, and they make sure that it's exact as you can possibly have.
All right. Let's go to Linda from Madison. Hi, Linda. What's your question?
Hi, my question is, my grandchildren are coming, they're teenagers from California. And to be honest with you, I want to see them so desperately, but I'm afraid. I'm a 73-year-old woman, and I'm afraid.
You have good reason to be afraid. You hit it right on the head. You want to see them, you want to hug them, you want to be with them. They're in California. If they haven't basically quarantined for 2 weeks, what does it mean? Because they're going to go into the airport, they're going to get on an airplane, they're going to be in the airplane. The airport is probably worse than the airplane. Then they're going to get into another airport, and then they're going to see you. And when they see you, they might have COVID. It might be in their clothing, it might be in their mouth, it might be on their body, and you're 72 and you're at risk. So the answer is clear. The reality is I wouldn't have my grandchildren come here during the summer of this year, and I would just have to give it up, and I would be very sad. On the other end, if your grandchildren bring COVID, which could be death or serious illness, into your house, how are they going to feel, and how are your children going to feel? They're going to feel awful, and it's very sad. But you got to do the right thing. You've got to stay safe.
Zorba, I wanted to ask you a question. I don't know, I had not had a chance to see if this is true or not, but I did see an article that claimed that there are some hand sanitizers out there that are not good for you, that you should stay away from. Have you heard of anything like this?
Basically, hand sanitizers, as long as they are 70% alcohol, which is equal parts Everclear, which is 100% grain alcohol, and cheap vodka, as long as you do equal parts of that together and you get to 70%, they're good. I've not read that one is worse than another. Maybe there are fake hand sanitizers that instead of being 70% alcohol are 50% alcohol. But on the other end, it's doing your hands, but it still is socially keeping yourself 6 feet away. That's the most important thing.
Should an alcoholic
there may be fake hand sanitizers out there, because in America there is always fake everything. But why would somebody fake a hand sanitizer?
Right, during this time.
Should an alcoholic stay away from using that?
Well, no, you can use 100% grain alcohol with vodka, and then equal parts. That equals hand sanitizer. But I've gone to grocery stores. You can now buy commercial hand sanitizers in most grocery stores, and I would just go to the commercial stuff, because then they also usually put in some aloe or something else to keep your hands moisturized. Otherwise, your hands dry out.
All right, do we have time for another call? Oh, we're out of time. I'm sorry. We are out of time. Zorba, thank you. Thank you, everyone, for calling in. We'll do this again next week. People still have a lot of questions about all of this.
They do. They do.
Thank you, Zorba.
We'll have a final check of your forecast coming up.